Is ibuprofen more effective than paracetamol in the treatment of pediatric fever? So the first thing I did in the research process was break down the question using the PICO framework. So PICO stands for Population, Intervention, Comparison and Outcome. So through looking at the question above, we can see that population is pediatric, intervention is paracetamol, comparison is ibuprofen, and the outcome is fever is reduced or managed. However, the outcome is not applicable when conducting the research. Once all the PICO elements are identified, we can formulate the PICO answerable question. In this case, being in pediatric patients suffering from fever, is paracetamol a more effective treatment than ibuprofen? So the next step is to find the key and alternative words. So in the question, we can see that the key words are ibuprofen, paracetamol, and pediatric. So now that we have the keywords, we can identify the alternative words. So for pediatric, the alternative words are pediatric, children, child, and infant. For ibuprofen, it is Advil and Nurofen. And for paracetamol, it's Panadol or acetaminophen. So now that we have the fundamentals laid out, we can start conducting the research. The first step that I did was accessing the UOW library page and finding the A to Z databases link. I then found the SNUG link and logged into that. This now brings us to step 2. Once logging into the SNUG database, I merged Medline into it to conduct the research using both databases at the same time. The third step I did was entering in the search bar the key and alternative words that we found before that are used within the PICO framework. I also made sure to use the Boolean terms and or to help refine the search even more. Here we can see that to start off with, I had a search result out of 1,730. And finally, the last step that I did was to add search limiters, which also helped to refine it even more, allowing me to identify the highest level of evidence in the end. On the left-hand side, you can see the limiters that I use when conducting the research, being language, age, subject major heading, and the year. Adding these limiters allowed me to refine my results from 1,730 to 4, and I was able to successfully identify the highest level of evidence. So how was the research refined to minimize excessive or unrelated articles? This was done by using the PICO framework, finding the key and alternative words, limiting the year of source within 5 years being 2018, entering the words from PICO framework one at a time, using the Boolean terms and or, searching through relevant databases that I use such as CINAHL and Medline, adding a language limiter being English, adding age limiter 2 to 5 years old, and adding a subject major heading being fever. Why did I choose to use CINAHL and Medline as my databases for this research? I have chosen to use CINAHL as it is a valuable primary evidence resource for nurses that has the highest level of evidence accessible, such as systematic reviews. It is also known as the most authoritative nursing and allied health literature. I have also chosen to use the Medline database as it is authoritative and peer-reviewed. It also allows you to see who did the study, the author of the results, and even where the study took place. It is a database that covers a wide range of topics and provides statistics that are accurate, which is why it is a reliable database. Search limiters are available in both CINAHL and Medline, making it easier to find evidence that is accurate and specific to the topic. Because the research subject concerns medical and nursing care, these databases are appropriate to use given that nurse and allied health professionals are dependent on them. So what was the highest evidence source that I found? The highest evidence that I found was a systematic review and meta-analysis. The title of this source is Comparison of Acetaminophen, Paracetamol with Ibuprofen for Treatment of Fever or Pain in Children Younger than 2 years. By the title, you can clearly see that it is relevant to the topic being, is ibuprofen more effective than paracetamol in the treatment of pediatric fever? So why was this the highest evidence source? This is the highest evidence source as you can see through the evidence-based practice pyramid. The top of the pyramid is systematic reviews. Systematic reviews are the highest level of evidence because they are based on the findings of several research found through thorough systematic literature search. The key findings from this source include: by the age of 9 months, 95% of children have been exposed to acetaminophen paracetamol. Although acetaminophen is frequently and commonly used as the first line in the treatment of fever and pain in children, there is some evidence that it has an increased risk of developing atopic diseases such as asthma. In children older than 3 to 6 months with a body weight more than 5 to 6 kilos, short-term use of ibuprofen for fever or pain is safe when extra attention is paid to their hydration status. This is because some people advise against using ibuprofen in young children, as it can have an increase in kidney injury, especially when dehydration is present. Despite this, evidence suggested that children who are given ibuprofen were more likely to become afebrile within 4 hours of onset symptoms. Therefore, it is faster acting than paracetamol. This source also said that there was low-quality evidence that showed that children who took ibuprofen had a decreased risk of developing asthma and/or wheezing than children who took acetaminophen paracetamol. Using the Rolfe et al.'s reflective framework to reflect on this research process. The aim of this assignment was to research my chosen topic using the PICO framework to formulate an answerable question, with a role to find the highest level of information. I found this task to be beneficial in understanding the importance of why high-level evidence is needed in the nursing field and the importance of using reliable databases. I used the databases CINAHL and Medline, which was efficient and easy to navigate, as I had previous knowledge and experience on how to use CINAHL. Determining the databases to use was one of the first steps to allow a smooth process to follow, making it easier to answer my question. Before beginning the research process, I had some previous knowledge on how to use the CINAHL database, which helped me to do this assignment more effectively. And along the way, I learned how to merge this database with another, being Medline, to help find the most accurate evidence. This gave me a sense of ease as I went into this with a positive mindset and a sense of calmness, as I didn't need to worry or stress myself out. During this research process, I learned how to add limiters and major subject headings, which helped to narrow down the search in order to identify the highest level of evidence, being the systematic review and meta-analysis. And once all the limiters were added, it was easy to distinguish and also understand the information I was reading about, which was whether ibuprofen was more effective than paracetamol. Overall, the research process was successful, as I was able to identify the highest level of evidence, as well as learning how to use the various databases and conduct an in-depth research. This will greatly assist me in my nursing career, as I will be able to recognize what a good research paper is, how to identify it, and also how to filter out information that is not needed. Completing this assessment task was a great experience, as it allowed me to gain a deeper understanding on evidence-based practice and the concept, as well as how to put it into practice. Now that I have a greater understanding of the evidence-based practice principle, this will be very beneficial for me, specifically while I'm on my clinical placements, as I will be able to use these researching strategies and skills whilst I'm on the ward and am conducting any specific research to further my knowledge. To conclude, it was quite easy to use CINAHL and Medline and merge the two databases together, as it was very accessible, making the process a lot easier. Merging the two databases was more efficient than having to search separately, as it allows there to be more variety and reliability when researching. The chosen question was straightforward, with the conclusion that ibuprofen is a more effective treatment than paracetamol. Although this was quite easy to do, I had to do it a few times to fully comprehend the steps and understand the use of the PICO framework. It took me a few trial and errors, but once I got the hang of it, things were much easier. The findings of this research was expected, which demonstrates that everything is being performed correctly within the medical field.